The topic of today's lecture is blood collection methods in laboratory animals. The collection of blood from laboratory animals is necessary for a variety of experimental uses, including determination of pharmacokinetics, antibody production, clinical pathology evaluation, etc. The blood may be collected from animals which are to survive the procedure or at the time of sacrifice as a terminal event. Whereas there is no limitation on the amount of blood that may be collected terminally, but the volume is limited in case of animals surviving the collection to prevent anemia and hypovolemia. Now we will discuss about the guidelines for collection of blood from experimental animals. As a general guide, 136 rule should be followed. This rule states that average blood volume of most laboratory animals is 6% of the body weight, that is 60 ml per kilogram body weight. The most blood that can reasonably be expected from a terminal sacrifice is 3% of the body weight, that is 30 ml per kilogram body weight, and no more than 1%, that is 10 ml per kilogram body weight, may be collected during 2-week period from animals surviving the blood collection. Although venipuncture is generally a satisfactory method for survival blood collection, exploration of a peripheral vessel may be necessary for animals requiring frequent collection of small quantities of blood. To apply, one should apply pressure to the blood collection site, especially when penetrating an artery, for several minutes post blood collection to prevent hematoma formation. In case of single blood draw, which is not repetitive, as a one-time large volume blood draw with concomitant intravenous fluid replacement, a maximum 2% of the body weight of a healthy adult animal can be removed, as long as fluid replacement consists of warmed isotonic fluids and both the fluid replacement and body blood withdrawal are slow and steady. In case of single blood draw repeated multiple times for multiple blood draws separated by a period of weeks, a maximum of 1% of the animal's body weight can be removed, that is 0.15 milliliter from a 15 gram of mouse, 50 ml from a 5 kilogram cat, and 400 ml from a 40 kilogram dog can be removed. A 14-day recovery period is needed for the average healthy adult animal to recover from this blood loss, although the blood volume is restored within 24 hours after blood withdrawal. 2 weeks are needed for all constituents of the blood to return to normal. Then multiple blood draws. If blood must be drawn more frequently than once every 2 weeks, a total of 0.5% of the animal's body weight can be removed each week, with this total volume being spread out over the entire week if needed. These guidelines are for normal healthy adult animals. Animals that are aged, stressed, have undergone experimental manipulations, or are suffering from cardiac or respiratory disease may not tolerate this amount of blood loss. Now monitoring is very important. By monitoring the hematocrit or packed cell volume and or hemoglobin of the animal, it is possible to evaluate whether the patient has sufficiently recovered from a single blood draw or multiple blood draws. After a sudden or acute blood loss, it takes up to 24 hours for the hematocrit and hemoglobin to reflect this loss. This means that after a 1% of the body weight blood loss without fluid replacement, an animal's hematocrit will not show a measurable drop for several hours and will not stabilize for 24 hours. After 24 hours, although the blood volume will normalize, the number of red blood cells will be measurably reduced. In general, if the animal's hematocrit is less than 35% or hemoglobin concentration is less than 10 gram per deciliter, it is not safe to remove the volume of blood as discussed in these guidelines. These guidelines are given in the standard operating procedure for animal house activities of our UPUMS. Now we will discuss about the blood collection in mouse. There are 6 different methods: blood collection from tail, blood collection from orbital sinus, blood collection from cardiac puncture, blood collection from saphenous vein, blood collection from dorsal pedal vein, and blood collection from jugular vein. First is blood collection from tail in mouse. It is done for collection of a small amount of blood, approximately 0.1 milliliter. For this, first place the mouse on the case lid and rest the loose skin behind the ears by the thumb and forefinger. Then push the mouse into the restrainer. Leave the tail of the mouse outside the cover of the restrainer. Amputate the tip of the mouse tail by scissors. massage the tail and collect blood by pipettement. Second is blood collection from orbital sinus in mouse. One should apply anesthetic before blood withdrawal. It's a convenient and easy method for blood collection in mouse. Up to 0.5 milliliter of blood can be collected by this method. For this, first anesthetize a mouse by intraperitoneal injection. Use a sharp and glass capillary tube to penetrate the orbital conjunctiva and rupture the orbital sinus. Collect the blood with a wire. These are some additional important points for retroorbital blood collection. It should be performed by or under close supervision of experienced personnel. Whenever possible, alternative methods of blood collection such as submandibular, which is preferred method, or saphenous sampling should be considered. This technique may yield a large sample volume, so will not be appropriate for frequent small blood volume collection. Episodes of retroorbital bleeding should be every other week only. Repeated bleeding should use alternate eyes. Maximum number of bleeds per animal is 2 per eye. A small amount of triple antibiotic ophthalmic ointment be applied to the eye after the technique, after using this technique. Then third is blood collection from cardiac puncture in mouse. It is a preferred technique for terminal collection of large blood volumes and for collection up to 1 ml of blood within a short period of time. It must be performed under general anesthesia. For this, anesthetize a mouse by intraperitoneal injection. Disinfect the thorax area with 75% alcohol cotton ball. Search for the maximum heart palpitation with your finger and insert a 24 gauze 1 inch needle through the thoracic wall at the point of maximum heart palpitation. Withdraw the blood slowly by your right hand. In this, the animal should be sacrificed at the time of completion of procedure prior to awakening from the anesthesia. Then fourth is blood collection from saphenous vein in mouse, also known as lateral tarsal vein. The saphenous vein is located along the lower portion of the hind leg. This method is used when multiple samples or small volumes are to be taken in the course of a day. It can also be applied on rats, hamsters, gerbils and guinea pigs. For this, place the mouse on a case lid and grasp the loose skin behind the ears with your thumb and forefinger. Place the mouse in the restrainer. Pull out the leg and remove the hair with the help of an assistant. Hair can also be shaved by using a small scalpel. The saphenous vein is seen on the surface of the thigh. Apply Vaseline after disinfecting the surface area to reduce clotting and coagulation during blood collection. And use a 24 gauge 1 inch needle to puncture the vein and release blood from the saphenous vein. Use a pipettement with tip to collect blood from the saphenous vein. Approximately 100 microliters can be collected by this method. After this, flex the foot of the mouse to reduce the flow of blood back to the puncture site. A cotton ball is applied to the puncture site to stop further bleeding. This is again the photograph showing the blood collection from saphenous vein. Fifth is blood collection from the dorsal pedal vein. A small amount of blood may be collected by this method. And sixth is blood collection from the jugular vein. This photograph is showing the proper positioning of the mouse for blood collection from the jugular vein. This is the location of jugular vein in mouse. Blood collection from the jugular vein. We will discuss this in detail under the blood collection from rat. Now collection of blood in rat. First is again blood collection from jugular vein. Second is blood collection from tail vein. Third is blood collection from cardiac puncture. First we will discuss the jugular blood collection in a conscious rat. For this, first calm the rat down before restraining by gently stroking the animal. Restraining of animal is very important. Then restrain the rat by grasping the skin over the nape of the neck and shoulder region with your thumb and index finger, which is called as scrubbing. We have already discussed this in handling of laboratory animals, last lecture. Once you have scrubbed the neck, gently turn your hand over so the rat is lying comfortably in the palm of your hand. Do not squeeze the rat around the thorax region because that could cause difficulty in breathing, and make sure that the rat's body is straight and not bent or curled in your palm. With your other hand, use index finger to lightly hold the head out of way. Do not put too much pressure on the rat's head or neck. With thumb, hold forelimbs back while another technician shaves the area. Area is shaved. Have other technician wipe down the shaved area with an alcohol swab. And with your other hand, use index finger to lightly hold the head. Do not put too much pressure on rat's head or neck. With thumb, apply slight pressure on vein proximal to the collection site so it will distend. This will make the jugular vein more prominent for easier visualization, and the bottom half of rat is still just resting in palm of the hand. Have the technician syringe and needle ready. Use a 1 ml syringe with a 23 gauge needle. Insert the needle through the skin right around the middle point between the sternum and shoulder area where you should see the vein. Advance slowly. Create a slight vacuum within the syringe while advancing your needle. Once you hit the vein, a small drop of blood will leak into the hub of the needle. Try not to let your syringe move around and keep drawing back on the plunger. Do not pull back too fast because it might cause the vein to collapse. Once you have obtained the desired amount of blood, apply a slight amount of pressure to the puncture site. Second is collection of blood from tail vein in rat. The veins are located on the lateral aspect of the rat's tail. General anesthesia is needed for this method, and a small amount from 0.1 to 1 ml will be collected. And this is the optimal site of blood withdrawal is around the distal 1/3 of the tail, since this part of tail gives better visualization of the veins. Disinfect the tail with 75% alcoholic cotton ball. When the needle penetrates the epithelium of the tail, pull back the plunger a bit to create negative pressure inside the syringe. Then push the needle in the vein slowly until blood gets into the dead space of the needle head. Pull back the plunger by the ring finger to withdraw blood from the tail vein. Using the scalpel to make a small amount of wound on the tail is also an option for collecting blood from the tail vein. Blood can be collected by using a pipette man. The third is collection of blood from cardiac puncture in rat. General anesthesia is needed. Large amount up to 3% of the body weight may be collected by this method. These are the relative locations of the heart and thorax, heart and diaphragm in the rat thorax. Disinfect the left before going for this procedure. Disinfect the left thorax with 75% alcoholic cotton ball. Then search for the point of maximum heartbeat. Insert the needle straight on the selected point and withdraw blood by your left hand. Again, the animal should be sacrificed at the completion of procedure prior to awakening from anesthesia. Then blood collection in rabbit. We will discuss these points: intramuscular injection, subcutaneous injection, blood collection from ear vein, blood collection from ear artery, blood collection from carotid artery. The intramuscular injection in rabbit is the most common site to administer antibiotic, tranquilizer and anesthetic. For this, disinfect the skin on the top of the thigh muscle. Insert the needle perpendicular to the surface of the skin and inject the substance inside the syringe. Then subcutaneous injection in rabbit, the most common method for immunology study. And for this, disinfect of injection site by 75% alcohol directly or 75% alcohol cotton ball. The subcutaneous injection in rabbit is given in the flank region. We have already discussed in last lecture in handling of laboratory animals. Pinch the skin up and insert the needle in for injection. Keep the needle tip in skin for a while after injection to prevent leakage of substance from the needle, which may be due to imbalanced pressure of emulsion inside the syringe. Then the blood collection from ear vein in rabbit, first method. It's a common location for a small amount of blood collection. Tranquilizers may be used for nervous rabbit or small sized rabbit. This is ear vein before administering of tranquilizer, then ear vein after administering of tranquilizer. Insert the needle into the ear vein with needle tip surface up. Fix the position of needle by your left thumb and withdraw blood from the ear vein. Press the cotton ball on the top of the injection site before pull out the needle. Apply a clip on the top of the cotton ball for 2 to 3 minutes to stop further bleeding. Second is blood collection from ear artery. The tools for blood collection, collecting 50 ml blood from ear artery are these: 75% alcoholic cotton ball for disinfecting the ear surface, 21 gauge rinsed infusion set with 50 ml syringe for blood collection, dry cotton ball and plastic clip for prevention of further bleeding. Apply same procedure as collecting blood from the ear vein for blood collection from ear artery. Third is blood collection from carotid artery in rabbit. It must be done under the general anesthetic condition. The blood up to 4% of the body weight, this much amount of blood may be collected by this method. These are the steps for this for the blood collection from carotid artery in rabbit. First is restrain the. We will discuss this by using photographs in the coming slides. First is restrain the anesthetized rabbit on the surgical table. Remove the hair around the neck area. Make a 5 cm opening on the midline of the neck. Search the carotid artery with a tissue forceps and a homeostatic forceps. Isolate the carotid artery from the vagus nerve and other connective tissue. Tie up the distal end of the carotid artery by silk suture. Clip the proximal end of the carotid artery with a bulldog clamp and insert a 16 gauge intravenous catheter into the artery. Fix the position of the catheter tip by 2 silk suture knots. Release the bulldog clamp and collect blood from the artery through the catheter into the centrifuge tube. First step is shown in this pic. Restrain the anesthetized rabbit on the surgical table. Second is remove the hair from the neck area. Third is make a 5 cm opening on the midline of the middle line of the neck. Then search the carotid artery with the tissue forceps and a homeostatic forceps. And isolate the carotid artery from the vagus nerve and other connective tissue. Tie up the distal end of the carotid artery by silk suture. Clip the proximal end of carotid artery with a bulldog clamp. Insert a 16 gauge intravenous catheter into the artery. Fix the position of the catheter tip by 2 silk suture knots. Then release the bulldog clamp and collect blood from the artery through the catheter into the centrifuge tube. There is another method for blood collection in case of mouse. This is called as mouse submandibular phlebotomy. Before going for this, proper restraint of mouse is required. Locate the back of the cheek pouch, the submandibular area. There is a vascular bundle located at the rear of the mandible, which is a convenient and consistent source of blood. This is submandibular area. A sterile sharp lancet or needle is used for the phlebotomy. The blood is collected drop by drop under use gentle pressure and clean compress to assure hemostasis. And these are the table is showing the administration volumes for laboratory species, different species: guinea pigs, hamster, mouse, rabbit, rat, ferret, dog, cat, fowl, and this is macaque of up to 5 kg body weight. And different routes: intravenous or arterial, intraperitoneal, intramuscular, subcutaneous, oral, intradermal. For example, in case of mouse, the administration volume through intravenous route is 0.2 ml. By intraperitoneal route, 3 ml may be administered. 0.05 ml per site for intramuscular, 0.5 ml for subcutaneous. Maximum 2 to 4 sites may be used for subcutaneous injection in mouse. Then for oral, 20 ml per kilogram body weight of volume may be administered, and 100 microliter per site for intradermal administration. Likewise, in other species, the data is given. And these are the suggested hypodermic needle sizes for laboratory animals. Different species: guinea pigs, gerbil, hamster, mouse, rabbit, rat, ferret, dog, cat, rhesus, sheep. For example, in case of rat, 25 gauze needle is used for intraperitoneal injection. For intramuscular, 25 gauze. Again for subcutaneous, 25 gauze and 25 to 27 gauze for intravenous injection. And for sheep, it is 19 to 21 for intraperitoneal, intravenous and subcutaneous. For intramuscular, 21 gauze will be used. These are the sampling sites in laboratory animals. First is jugular vein. No general anesthesia is needed, and it is followed in rat or dog or rabbit species. And the tissue damage is also low by this method. Repeat bleeding can be done. A fair amount of blood may be collected by this method. Second is cephalic vein. By using cephalic vein, the blood collection. No general anesthesia is needed, and low tissue damage. Repeat bleeding can be done. Fair amount of volume may be collected by this. And species, it is followed in macaque and dog. Then third is saphenous or lateral tarsal vein. No general anesthesia is needed. Low tissue damage is there. Repeat bleeding can be done. A good volume of blood may be collected by this method. Followed in mouse, rat, macaque and dog. And fourth is marginal ear vein. No anesthesia is needed. Only local anesthesia is needed. Low tissue damage. Repeat bleeding can be done. Good amount of volume of blood may be collected. Followed in rabbit, femoral vein. And by this method in macaque the blood may be collected. No general anesthesia is needed, low tissue damage and repeat bleeding can be done, good amount of volume may be collected. Sublingual vein, general anesthesia is needed, low tissue damage, repeat bleeding can be done and good amount of blood may be collected, and it is followed in rat. Lateral tail vein, no general anesthesia, low tissue damage, repeat bleeding can be done and good amount of volume may be collected by this method. Rat and or mouse may be followed. Central ear artery, no general anesthesia, only local anesthesia is needed. Low tissue damage is there and repeat bleeding can be done. Fair amount of blood may be collected by this method. Followed in rabbit. Tail tip amputation, less than 1 to 3 millimeter of section of tail is amputated. General anesthesia is needed. Moderate amount of tissue damage is there. Repeat bleeding cannot be done and the volume is very less. And mouse or rat, it is followed. And retrovalvular plexus, it is by using this it is followed in mouse or rat, and general anesthesia is needed in this method. Moderate or high tissue damage is there. Repeat bleeding can be done and good amount of volume can be collected by this method. By cardiac function, general anesthesia is needed, moderate amount of tissue damage is there, no repeat bleeding as it is a terminal event, and the good amount of volume may be collected by this method, and this method is followed in mouse, rat or rabbit. These are the circulating blood volume in laboratory animals, in species mouse, rat, rabbit, dog, eagle breed generally it is used for experimental purpose, and rhesus macaque. The blood volume in milliliter per kilogram, for example in mouse, the mean volume is 72 milliliter per kilogram and the range is 60 to 80 milliliter per kilogram body weight. Likewise in other species the data is given. These are the limit volumes for blood collection and recovery period. In case of single sampling, for example in toxicity study, if the percentage circulatory blood volume removed is 7.5%, then the approximate recovery period is 1 week. If the blood removal is 10%, then the recovery period is 2 weeks, and if it is 15%, then the approximate recovery period is 4 weeks. In case of multiple sampling, for example toxicokinetic study, the percentage circulatory blood volume removed in 24 hours, if it is 7.5%, then the approximate recovery period is 1 week, and if it is 10 to 15%, then the approximate recovery period is 2 weeks, and if it is 20%, then approximate recovery period is 3 weeks. These are the total blood volumes and recommended maximum blood sample volumes for species of given body weight in mouse, rat, rabbit, dog and macaque. For example, in case of mouse, the total blood volume is 1.8 ml, and these are the recommended maximum blood sample volumes. 0.1 ml if 7.5% of the total blood, 10% of the total blood volume 0.2 ml, 15% of the total blood volume 0.3 ml, and 20% of the total blood volume 0.4 ml. This data is given in other species, rat, rabbit, dog and macaque. There are some other methods, miscellaneous methods of administration of drug. First is foot pad or tail-based injection, nebulization or administration into the respiratory tract, instillation into eyes, intra-articular injection, and per rectum. In case of foot pad or tail-based injection, substances such as fluents, complete adjuvant may be injected into the foot pad or tail base of rodents to induce localized or generalized arthritis respectively. Foot pad or intraplantar injection is also used to study the delayed type of hypersensitivity reactions. Then second is nebulization or administration into the respiratory tract. Some liquids may be nebulized into the tiny particles for administration into the respiratory tract. The compound or drug is given in a spray which is inhaled or in some cases absorbed through the skin. For example, inhalation methods in rats. And instillation into eyes. The drugs for topical administration must be non-irritant. There may be discomfort, lacrimation, and corneal damage with scanning in the long term in this method. For example, in rabbits, the eye irritation is there. Then intra-articular injections are given into the joints, must be carried out aseptically. The procedure should be practiced on cadavers first. In the last, per rectum. Fluids and some drugs may be given into the rectum or distal colon. Drugs may be given by a flexible rubber or polythene tube or a rigid sigmoidoscope. For example, anginas may be given to empty the rectum before surgery or radiography. These are the references for making this presentation. This is all about blood collection methods in laboratory animals.